Hi everyone, my name is Millicent, biomedical engineer by profession. I've been a biomedical engineer for the last 13 years and above, and I've worked in various tertiary private hospitals in Kenya, working at various senior level in biomedical engineering. Currently, I work with Nest 360 as the regional director, biomedical engineering implementation. Nest 360 is an international alliance united to end preventable newborn deaths in African hospitals. I also serve as Honorable Secretary General for the Association of Medical Engineering of Kenya, AMEC. I'm a member of Global Clinical Engineering Alliance, an advisory member for medical devices at WHO, a medical device policy review committee member at the Kenya Bureau of Standards. As a result of WomenLift Health Program, now I'm a founder and a co-founder of Women in Biomedical Engineering Kenya and African Women in Biomedical Engineering Alliance. Now, my project is African Women in Biomedical Engineering Mentorship, and it aims to enhance representation of women in biomedical engineering field that has historically been dominated by men. It is meant to empower girls and women and show them real-world experience during their studies and also provide relevant role models in the workplace. And so it seeks to boost the confidence and empower women to exceed in biomedical engineering career. So how do I want to achieve and realize this objective? This I will achieve through strengthening initiative, which is targeting individuals, communities, society as a whole. And this it will be able to aim and address the low participation of women in biomedical engineering field. So why do I need to have mentorship in biomedical engineering for women? A number of studies have been carried out globally on how many women, the percentage of women versus men who are carrying out courses in career or in STEM related careers. And biomedical engineering is among the STEM related career. And so according to the one that is displaying on my screen, the World Bank group, they indicated that about 35% only compared to men, women are taking the STEM-related courses, which among them is biomedical engineering course. And so they indicated that majority of women are likely not to take STEM courses, and majority of them are likely to fall out of STEM courses even after taking. And again, majority of them, even after taking the STEM courses and excelling and graduating, they are more likely not to be given job opportunities at the job market. And so that is why we need a call to ensure that we empower the women in biomedical engineering to be able to reach the job market. And how do I want to achieve this? I want to achieve this through a hub and spoke model. What do I mean by hub and spoke model? So I plan to form an umbrella body called African Women in Biomedical Engineering Alliance that is going to be a support system for all the women who have done biomedical engineering course in Africa. And then after that, I need various spokes in various African countries. That is various alliances or groups or associations specifically for women who have done biomedical engineering. So now currently, and then after that, we'll be having mentorship and advocacy. So the mentorship and advocacy will be ensuring that there's a shift of attitude towards the women who are taking towards the STEM-related subjects, and also a shift in attitude towards women who have done biomedical engineering and are in the job market. So that is what the mentorship and advocacy is going to be. Once we have the hub and spoke model, then we'll ensure that every corner we have a support system for women in biomedical engineering. So what are some of the outcomes? The plan is slowly coming to see the light of the day. So currently, together with some of my colleagues, have been able to form African Women in Biomedical Engineering, what we refer to as AWIBEA. And it is the umbrella body for all the women in biomedical engineering, supporting them and giving them a shoulder to lean on. And one of the spokes that has already been formed and has taken shape is WeBEC, that is Women in Biomedical Engineering of Kenya. We had a physical meeting last year, and women are so excited to get a support system and to get a shoulder to lean on. And what is the way forward? Way forward is to form 10 additional country-specific associations or spokes for women in biomedical engineering by 2030. What is my closing message? So participating in WomenLift Health Mentorship Program has rewarded me with a year full of self-discovery, lots of learning and personal growth. I've become a flexible, inclusive, and strategic leader who is full of resilience, passion, and desire to empower fellow women, and also champion for diversity, equity, and inclusion within the healthcare sector. I aspire to establish a network of supportive system for women in biomedical engineering across sub-Saharan Africa, with the initial aim of creating 10 such networks or spokes in 10 additional countries by 2030. What is the call to action? The call to action for the training institution: provide opportunities for learning, networking, and for development to empower girls and women to excel in this male-dominated career, which is biomedical engineering. What about to employers? Unlock your full potential of your workplace by providing job opportunities for women in biomedical engineering. What about donors? To our donors, we need your support by funding our mentorship activities. Some of these activities are physical and they require your support in terms of funding. We'll then be able to empower a female talent in biomedical engineering. And to everyone else, become an advocate for gender diversity and inclusion in healthcare technology. Support mentorship initiative, amplify the female voices, and create a culture of support and collaboration worldwide, globally. Thank you so much.